Lacing up those running shoes, hiking boots, maybe just to take a stroll? If you're about to put your legs to work, you need to be stretching your calf muscles. Seems simple enough, right? You know how to do it. You've known how to do it since grade school. The reality is, most people don't know how to properly stretch their calf muscles. Yep, you heard me right. And that results not only in pain and strain, but also injury. You don't have to take my word for it. That is why we have Dr. Scott Patton here. He's not only a chiropractor, but also an athletic trainer, and he'll show you how to do it right. So, in whatever way you put your legs to work, you won't be put off by discomfort later. Are you ready? Let me clear the floor and make some room for Dr. Scott.
Whether you're an athlete and you exercise regularly or a couch potato and you're just starting to get into exercise now, you've probably experienced a calf injury. Now, did you know that we all use the term calf, but that it actually makes up two separate muscles? Probably not. Yeah, the calf, which we use as a singular, is actually a plural. So the interesting thing about the calf is that one of the two muscles crosses two joints, the other one only crosses one joint. Now, we're going to use Dr. Justin Gehling here as one of our examples, and we're going to show you each muscle and how it works. The first muscle we're going to talk about is the gastrocnemius. That's part one of the two muscles of the calf. Now, the gastrocnemius, as I said, crosses two joints. It crosses the knee joint and the ankle joint. The gastrocnemius comes down and inserts into the Achilles. It forms the Achilles tendon, which inserts into the heel. The gastrocnemius starts way up here, behind the knee, but to show you, we're going to draw that line right there. That's the level that it starts. The soleus, which is the second of the two muscles, starts down here. So, if you can use your imagination, how might somebody not stretch the calf properly? Well, let's look at this. If the gastrocnemius crosses two joints, naturally, when the knee is straight, the distance from here to here is longer. So as Dr. Justin's knee is straight, that calf muscle is very taut, very, very tight, okay? Which means the gastrocnemius is at its full stretch. Most of us stretch our calves like this. He's leaning into it with a slight flexion of that ankle, and he feels a nice taut stretch, which is great, but you're only getting 50% of it. So you might be wondering now, if there's two muscles, one crosses the knee joint, one doesn't, how do I effectively stretch that second muscle? Simple. Take the gastrocnemius out of the picture. By bending the knee, just lift up the knee a little bit, okay? Now, by bending the knee, we took the gastrocnemius out of the picture. Because remember, the gastrocnemius crosses two joints. It starts up here, but inserts all the way down there. So if we straighten the leg, it's very tight, very taut. If we bend the leg, that gastroc turns into jello. So what happens is we're just simply taking that out of the picture so we can get an effective stretch of the soleus. How many people do you know that stretch the calf, the gastrocnemius, with a straight knee, but still get calf injuries? These are the people that aren't stretching that soleus properly. So how do we stretch it? Well, if you haven't figured it out yet, simple. Since we took it out of the picture, so Dr. Justin, once again, push down, lean forward, and you feel that.
Yes.
Okay. If you don't feel that, pull right about here. You're doing one of two things wrong. You're not pushing the heel to the ground, or you're not leaning forward to load it. Now, to properly stretch that muscle, lean forward, feel the stretch until you don't want it to hurt, but let it stay there for 20 to 30 seconds. Take a break. Do it again 2 more times. Now, by doing this, we're taking the gastrocnemius out of the picture and isolating that soleus. The people who are stretching their calf muscles improperly, when they injure their calf, they're always complaining of the injury deep They'll say it's a really deep pain, I can't really isolate it, and when I try to stretch it with a straight knee, it doesn't feel like I'm getting it. Those are the ones who aren't stretching the soleus. Probably because they didn't know that the calf was made up of two muscles. But when you realize the anatomy of the body, the gastrocnemius, which starts here, crosses two joints, the knee and the ankle. The soleus, which is the second part of the calf, only crosses one joint. When we bend the knee, we effectively take that gastrocnemius out of the picture. So let's do it one more time, Dr. Justin. Point that knee, that heel to the ground, lean your knee forward, and you do feel it right there, correct? That's an effective calf stretch. Hold that stretch for about 20 to 30 seconds, take about a 10-second break, walk around, re-stretch for 20 to 30 seconds, and then repeat it a third time. This is the way we effectively stretch that soleus muscle. Now, next time that you talk about the calf, remember, although you're using a singular terminology, there's actually two muscles. So if you see anybody that's stretching their calf with a straight knee, it's great, but they're only stretching 50% of it. They're missing the soleus, and they're going to put themselves at huge risk. The biggest danger to most of these people is a big competition coming up when their training gets up and just exceedingly high, and they're doing more than what they usually do. They're putting themselves at risk. I'm not going to use the term calf injury. I'm going to use the term soleus injury. And once you get a soleus injury, it's really hard to rehab. So as long as you know how to prevent these by doing the right stretches, you're going to be perfect. So the next time you exercise and the next time you talk about calves, remember, number one is a gastroc stretch with a nice straight knee. Number two is a soleus stretch with a bent knee. And you'll effectively stretch both calf muscles and prevent those future injuries.